and we link together, as one would say, to design and redesign strategies to address injustice. We have a staff who I count on every day and true partners to me and to all of you. Maybe you all can stand as I say your names. They are Greg Lang, our Schweitzer. Equity and health access for everyone. I come home regularly revitalized. These are committed people who went together, know if they can't figure out how to work with and sometimes outthink entrenched interests, no one can, so we do. And we do it with many of you, partners committed to the fight for healthcare justice. That's why you're here, and that's why you take the fight out there, and that's why I love what I do and all of you. I have the privilege of working alongside Quentin Young every day. He has spent countless hours mentoring me, solving problems with me, and helping to guide this organization to do things that seemed unlikely at best and impossible to people other than Quentin, who won't recognize that anything's impossible. He long ago taught me that if you don't need to take credit, you can get a lot done. My life is full of good friends and family, many of whom are in this room tonight. I thank you for being here, and lots of you came in from out of town to be here for me. I've been thinking a lot about our history as we planned for tonight. The brilliance of John McKnight to design a group like Health and Medicine. I don't know how many people thought 30 years ago that health and medicine would be alive and thriving today. I'm not sure I did. But I'm glad we're here. We fill a role in our city, our county, and the state that no other group does. We have the freedom to call it as we see it, and the track record to be trusted in the corridors of power and the streets of our communities. The champions of civil rights, the women's movement, health rights, and all who came before us and upon whose foundations we build and who partner with us on myriad health and medicine projects. Hard-fought battles we've waged and sometimes won, like finally getting legislation to establish freestanding health centers. And many, many, many battles we have yet to win. Single-payer national health insurance, for one. We live in most difficult times where even past victories and assumed societal verities like Medicare, Social Security, and collective bargaining are at risk. But I would have learned nothing from John McKnight, Bobby Hall, and Quentin Young if I didn't say to all of you that I'm still optimistic. Together we will prevail because we must. So thank you, Health and Medicine, for honoring me tonight, and to all of you, thank you for your support and your partnership